Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about a test that I've recently begun to use in my practice. It's called MyPerioPath, and the reason that I'm using it is that it's a saliva test. You spit in a test tube, and you send it off, so there's no blood involved. And they analyze your saliva for the various bacteria that can be pathogenic. And in so doing, you can begin to see if there is an oral dysbiosis. We know that oral dysbiosis correlates heavily with gut dysbiosis and probably brain dysbiosis, all of the organisms that have gone to the brain. This is super interesting because what Dr. Volchonok was talking to me about is that there is a phenomenon called leaky gum, just like there's a phenomenon of leaky gut, and just like there's a phenomenon of leaky brain. There's a barrier that the pathogens can um, can cross, right? And when the pathogens cross the barrier, then they get into the places of the body where they simply should not be, and that's where they cause a lot of inflammation and tissue destruction and basically initiate disease. So one of the things I've begun to initiate is this MyPerio test, and it's been so interesting. There is absolutely a correlation between the amount of pathogenic um, oral bacteria and the degree of sickness that the patient is exhibiting. Now, the question is, and I asked Dr. Volchonok this, is the Lyme causing the oral dysbiosis, or is the oral dysbiosis sort of going along with the elevating pathogen levels? And he seemed to think that Lyme was not causing it. I I suspect otherwise, but he's the Lyme-literate dentist, so I didn't want to disagree with him, but I don't suspect it is causing that. Um, I think it's something that goes along as the pathogen load increases, the dysbiosis just goes crazy, and that's what I think is going on. So, anyways, it's a great test because it's simple. There's no blood tests. They send it right to your house. You do it in your house and you send the test off. And it takes about 2 weeks for us to get the test results back. And there's three categories: very pathogenic bacteria, moderately pathogenic bacteria, and no pathogens at all. And so you begin to see the degree to which there is oral dysbiosis, and I can tell you it's pretty significant in my patients. I've probably done 10, and not all of them have oral dysbiosis, but most do. I would say 8 out of 10 have oral dysbiosis, meaning that their mouth is set up to become diseased. What do I mean by diseased? Gingivitis, periodontitis, cavitations, root canals, all the things that we don't want. So, anyways, if you're interested in doing a periopath, it's not very expensive and it's really easy to do, and it does yield quite a bit of information about the health of your mouth. And we know that the mouth is a super important entry for all kinds of things: airborne pathogens, food pathogens, all kinds of pathogens. So it's really important. And I know you all know that I've been on this oral systemic mouth microbiome path for like 4 months now, because I think that Dr. Volchonok is right. And the reason I say that is because I'm one of his patients. So I hope that you found this information interesting, and I hope that you'll consider looking at your oral microbiome through MyPerioPath. Have a wonderful day, you guys. Bye bye.